Okay, so this video is going to be about when you're giving hospice care, okay? Once you have a resident who's declined and, it's determined by, the family and us and the medical people involved in their care, like the doctor, if they decide, okay, it's time for this person to go on hospice, we kind of change gears in care, okay? So typically for most residents, when we give care, we are trying to either maintain or gain ground on strengthening, their physical abilities. We always want to promote independence, always. That is like number one. But when a resident ends up getting placed on hospice, the goal changes. Okay, we're no longer trying to promote independence. At that point, we are just trying to promote comfort. Okay, so a lot of the things that you might encourage a resident to do, like getting out of bed in the morning, we always want to try to encourage our residents to get up and get out of bed in the morning, so they can come to the table, have a nice healthy meal, and get their day going right, encourage physical activity and things like that. Well, once they're on hospice, if they're not wanting to get out of bed, you've encouraged them and, they're just too weak or they're too tired or, whatever the reason may be, maybe they're in pain, they're not comfortable. If they want to stay in bed, that's totally okay. We just want to make sure that we're doing everything we can as safely as possible with them being in bed. So eating, drinking, those types of activities that we would want someone in an upright, safe position for swallowing and chewing, that's not going to be obtainable when they are in the bed. So again, we'll be switching gears in that aspect also. We'll be wanting to make sure that we are providing them with substance and nutrition, but we need to choose foods that are going to be more safely swallowed in the bed. You always want to have the bed upright for the person to sit and eat. The person needs to be alert for you to be placing food in their mouths. If they are alert but they're just real slow and weak, that's okay. But if a person is not responsive or they don't understand what's happening, they're just really out of it, then that is not a safe situation to feed someone. So you would then only be doing fluids, and they need to be able to suck out of the straw, or at least open their mouth on command to maybe do a spoon of juice into their mouth or a spoon of jello, but they need to be able to be aware enough to open their mouth for you. If they're not aware enough to open their mouth for you, then they're not safe to give anything to. So just be aware of those things. So you're primarily going to be comfort based in the care. That means medications need to be able to be safely swallowed or possibly given a different route if oral is no longer safe. You'll also have a different paperwork that you're filling out, if you're responsible for a person's medications when they're on hospice. Hospice will be taking over the comfort meds, so anything that has to do with pain, any type of comfort at all. They don't consider like a probiotic and a cranberry pill and a blood pressure pill. Those are not comfort meds. A pain patch or a pain pill, Tylenol, those types of things are for comfort. So you would be able to call hospice instead of the pharmacy or the family. You would call hospice because they will be financially responsible for the comfort medications. So you'll need to make sure that you are leaving notes for the nurse. So I always have a folder when a person goes on to hospice. I always have a folder that we keep by the fax machine so that whoever's on duty, they can pull this folder out if the nurse shows up on their shift. And this is what the person who does their medications will, they'll just document on the lined paper. They'll just document on the lined paper a note for the nurse with the date, you know, for the week that we're in. They would put, you know, January 20th through the 27th, resident needs gloves, resident needs, you know, mouth swabs or peri spray. Maybe they need barrier cream. Hospice pays for all of the supplies. So you would just list everything that that resident needs each week on here so that whoever's working knows they can just give this folder to the nurse, and then the nurse will know what to do. The other option is you can, whoever's on duty, if there's not notes in here, give the nurse the whole medication bin. Just bring the whole medication bin out and let them know that you're not sure what meds are needed, but here's the bin so they can check. And that way they can see if we're low on anything and order it. Whenever the nurse comes, always order gloves. Every time. Every time the nurse comes, order gloves, because we go through gloves a lot, and they'll only allow 1 pack of gloves a week, I believe. So every week when they come, tell them we need gloves. We need gloves. Even if you're not sure about anything else, we need gloves. Every time you see them, okay? So, so you now know you have your folder here that you use for communicating with the nurse, and all the staff know this is where any notes for the hospice patient's nurse needs to go in here. If you have questions, write them in here. If you have requests, write it in here. If the family has requests for the nurse, write it in here. All communication with the nurse goes in this folder, and it goes up on top of the counter by the fax machine, so it's easily accessible. That way the nurse knows where it's at and she can grab it herself if you're busy, but whoever's on shift needs to grab this and give it to her. Okay? So the other forms that you need to get familiar with is one of these. Sorry, I'm trying to make sure the shine's not on it. One of these will always be in the hospice residents' prog notes, so that whenever someone comes to provide care from the hospice team, they will document the date and time they were here, who they are, and sign what the visit's for. Maybe it's a masseuse, maybe it's a chaplain, maybe it's the bath aide, the social worker. They all come. There's a whole team of people that come. You need to make sure they are signing this every time they visit, okay? That is your job. Make sure they're signing this, and make sure if they come and they're not already on the calendar, that you put them on there, okay? Even if they're already here doing the visit, put them on the calendar so that we have easy accessibility to see who came that day, okay? So the other thing that you need to get yourself familiar with is this form, okay, or this instruction, I should say. This is steps for post-mortem care. Okay, be familiar with this list. It's going to be really important, especially if you're new to providing hospice care. As a caregiver, you're going to want to know what to do if a resident passes on your shift, okay? Now, obviously the first thing you always do if you think a resident has passed on your shift is call me. Number 1, do not call family before you call me, because if you were wrong, you will cause a lot of unnecessary emotional strain on the family if you call them and tell them that their loved one has passed and you're wrong, okay? That's a lot to put a family through, and that's really gonna make us look bad, okay? So don't ever call a family. You always get a second set of eyes, which is me or whoever is managing, whoever's in charge. You would call that person. They would come down and they would confirm, okay? Once that person has confirmed, then we contact hospice. We notify hospice that the resident has passed, okay? Hospice will contact the funeral home so that the body can be picked up. Also, at that point, that's when we would contact the family if they're not here. Sometimes the family's here when it happens, and if that's the case, then they already know. But we contact the POA, and we let them know that the resident has passed, and the POA would then be responsible for contacting any other family that they would like to know. We always make sure that we offer the families an opportunity to say goodbye once a resident has passed. Some would like time with their loved one, to, you know, have some grieving time. Some don't want anything to do with coming after the body has passed. It just depends on, you know, the family members, what their preference is. So, but we always offer for them to have that opportunity before the body is picked up, to come and say any last goodbyes. If they do not want to, then we would then just prepare the body. We would make sure to remove anything important, if there's jewelry, if there's clothing on them, anything like that. Make sure that we clean them up. The more detailed instructions are here. I will just leave that for you to go over versus discussing it on the video. If you have questions about what's on this form, then please talk to me about it. Anyways, you want to make sure that you are prepared. Remember that we're supposed to be support to our families. So having a distraught, overwhelmed, panicked employee or caregiver is not the ideal situation when someone is losing their loved one, okay? You need to be the person who has the answers. You need to be the person who's providing comfort to the family, not the family providing comfort to the employee, okay? You need to be the brave one. You need to be the one who's professional and knows what to do. If there's something you don't know how to do, then you just calmly call me, and I'll walk you through that. But you don't want to be panicking in front of the family members or the resident. If the resident hasn't passed yet, always stay calm. The family wants to know that their loved one is in good hands, that you, the person in charge, knows what to do and knows what's going on and how to handle things. So you always stay calm, you always reassure them, and if there is something you're not sure about, you just let them know, you know, I'll go ahead and give Corey a call just to get confirmation on how we should handle this situation. I'll be right back. And that way they at least feel like someone is guiding the circumstances and that the staff on shift are following the protocols as they should. Okay? Makes sense? It's just really important to make the family feel like you're going to make sure their loved one gets the best care. You know, that's all any of us would want in those circumstances, is to know that whoever is giving the care to your loved one, that person is going to do the best possible job that they can. Okay, so that's what you always want to present. Always put the best foot forward for those family members, because this is going to be memories that they have for the rest of their lives around their loved one's care, and whether or not we provided those needs that they had. And we always want to make sure we are doing that. Anyways, so that's pretty much the majority of it. If you have, there could be other things going on, like a turning schedule. There could be if a person's maybe got a catheter, we'll be recording the input and output to make sure to see if they're getting enough fluids, to see if there's enough output. That nurses like us to track those kinds of things for them. Also, of course, we'll continue tracking BMs. And then you'll want to make sure that you're documenting the times that you changed the resident, so that whoever's coming on knows when they need to change the person. They'll know when they were last changed or when they were last turned. You need to just make sure that you are adding all that information on top of whatever you would normally add. Also, if we have someone who's not eating very much, if they're starting to decline, their appetite declines and their intake declines, we'd want to start tracking what you're feeding and what you're giving for drink, so that we can keep a close eye on that. Anyways, if you have any other questions about how we do hospice care, or other things that may be implemented, like when they start getting to the point where they're not getting out of bed, you would begin putting gowns on them. When a person is bedbound, you don't put pull-ups on them, and you don't put pants on them. Okay, those are things that only make the care more difficult. It makes it harder on the resident. It makes it harder on the staff. So we always use gowns and tabbed depends, so that they can easily be turned and changed in the bed comfortably by one staff. When you're still dressing them and changing them like they're able to stand, like they're still mobile, then you make it hard on the people who follow you, and you make it hard on yourself. So as soon as you have someone who's in bed, that's when you would begin the bed-bound care for that person. Also making sure that you're changing the sheets frequently when a person is bedbound, because they're now in the beds 24 hours a day. So changing the sheets once a week is not enough. You want to be changing the sheets at least twice a week when a person is bedbound, just so that they smell clean, the bed smells clean, and they're getting they can feel as clean as possible, which is another thing. You would also be doing bed baths instead of getting them into the shower. Usually when they're on hospice, they have a bath aid that comes. Typically the bath aid will take care of everything, but staff do need to make sure that you set out towels and clean sheets and a bed pad for the bath aid before they get there. Also make sure that they have supplies like the pink tubs, the body washes and stuff. They're usually pretty good about ordering those supplies when they're needed too. And then making sure that they put lotion on the resident after their bed bath, and then swabbing the mouth. Oral care is going to be really important when a person is bedbound. Sometimes when they take their pills or they eat something, the food will crust around their mouth, on their tongue, on their teeth. You need to make sure that you're taking a swab multiple times a day. Every time you feed them, every time you give them meds, every time that you do anything orally, you're going to want to swab their mouth afterwards, and then you're going to put lip ointment on them, and that just keeps them clean and presentable, so that when families come to spend time with their loved one, they look presentable. Even though they may not be awake, at least they're clean, and they can tell that we are giving them the best care that we can. Okay? So thanks so much for watching. Again, if you have questions, let me know. All right. Take care. Bye-bye.